Bharatiya Janata Party-led Modi government is coming up with National Health Policy 2017. The last National Health Policy was framed over 15 years back in 2002. 2017 National Health Policy aims to increase public healthcare expenditure to 2.5% of GDP, with more than two-thirds of these resources going towards primary healthcare. The policy is expected to bring healthcare for all, to all corners of the country, particularly the underserved and underprivileged. Highlights of National Health Policy 2017. Public health spending in National Health Policy 2017 by Government of India is to increase from 1.4% of GDP to 2.5% of GDP. The total amount is a whopping 3.5 lakh crore rupees. A little over 2 lakh crores will be allocated to primary health care so that its benefit reach every nook and corner of the country. India has over 5 lakh plus villages and hope they benefit from National Health Policy 2017. Government of India's Primary Healthcare Policy 2017 will be through a brand name called Health and Wellness Center, which will include care for major non-communicable diseases, mental health, geriatric healthcare, palliative care, and rehabilitative care services. What will this National Health Policy 2017 achieve? What are the targets and what are the projections? The target is to provide 2 beds per 1,000 population, which means 25 lakh hospital beds for 125 crore Indians. To reduce cost of medical treatment, government will provide free drugs, free diagnostic and free emergency and essential health care services. The National Health Policy 27 targets to increase life expectancy by 2.5 years in next 8 years, from present 67.5 years to 70 years by 2025. The National Health Policy 2017 will look for reduction of total fertility rate to 2.1 at national and subnational level in next 8 years, that is by 2025. The government expects to reduce mortality rate of children under 5 years of age to 23 per 1,000 in next 8 years, that is by 2025. The National Health Policy 2017 expects to reduce maternal mortality rate to 100 in next 3 years, to reduce infant mortality rate to 28 by next 2 years, reduce neonatal mortality to 16 and stillbirth rate to single digit by next 8 years. The Government of India expects to kick in Make in India umbrella policy for easing hurdles for manufacturing of drugs and devices. The Government of India will bring new medical education system which will be graded to meet challenges for sourcing millions of healthcare professionals required for serving 25 lakh hospital beds in India. There will be an increased demand for mid-level service providers like nurse practitioners, public health cadre, availability of healthcare professionals. Now the reality check and the challenges. Until 2014, only 11.3% of registered allopathic doctors were working in government hospitals in India. The rural penetration is even worse. The challenge is to provide more healthcare professionals for primary care in rural areas. Availability of trained doctors and nurses would help meet the new infant mortality and maternal mortality goals and build on the gains from higher institutional deliveries which exceeded 80% in recent years. Presently, the private sector provides 70% of all outpatient care and 60% of inpatient treatment in India. So public and private partnership is the only option left, as capacity building in government hospitals will take time. But then new challenges will come, like accountability, quality and cost of care provided by private sector health services. There will be an added challenge to provide robust and up-to-date health sector audit, which is required to get robust health data. Inputs from multiple sources and sample surveys are not compatible and so not comprehensive. The biggest challenge for Government of India will be the provisioning of essential medicines and diagnostic tests free of cost, which will reduce overall cost burden to patients.